Everyone. Welcome to the National Academy of Medicine. The National Academy of Medicine, I think, as you know, is one of the three academies which together oversee the programs of the National Academies of Sciences, Engineering, and Medicine. Our mission is really very straightforward, and that is to marshal the insights of those best informed to address the toughest and most important issues in health and medicine. And it's hard to imagine a gathering that is more representative of that charge than this one. Your focus, our focus today, is going to be on ensuring that we can apply the full range of knowledge on behalf of those who are sickest among us, those with the greatest needs and the greatest expenses. And similarly, we have in this room those who are most experienced, informed, and knowledgeable about the issues. So we have the opportunity to drive fundamental progress if we can in this third of three meetings meet the intents of the agenda and the planning committee. And that brings me to the first note of very strong thanks, in addition to the thanks to each and every one of you for coming today, and that's the thanks to Peter Long and the Planning Committee. Peter Long, as you know, is the president of the Blue Shield of California Foundation, the chair of the Planning Committee, and Peter, you've just done a spectacular job in navigating and leading the work, and you've been assisted and probably sometimes led by a very important and knowledgeable group of people involved. Melinda Abrams from the Commonwealth Fund, Jerry Anderson from Johns Hopkins Bloomberg School of Public Health, Tim Engelhardt from the Centers for Medicare and Medicaid Services, Catherine Hayes from the Bipartisan Policy Center, Aparna Higgins from AHIP, America's Health Insurance Plans, Frederick Isasi from the National Governors Association, along with Sandra Wilkness, Ashish Jha and Jose Figueroa from the Harvard School of Public Health, David Myers from the Agency for Healthcare Research and Quality, and Arnie Milstein from Stanford University. Let's have a round of applause for I know Peter didn't realize how much work he was getting into when he generously agreed to serve as chair, and I doubt that any of the folks on the Planning Committee realized just how much work would be involved, and they've risen to the occasion just beautifully. I'd also, of course, like to give special thanks to the Peterson Center on Healthcare. The Peterson Center on Healthcare is dedicated to identifying innovative solutions to improve healthcare quality and curb spending, and to expedite the spread of those solutions on a national scale. Our focus today, models of care for high-need patients, is naturally a significant focus for the foundation and the center. And Jeff Selberg, the executive director of the Peterson Center for Healthcare, and his colleagues have demonstrated stellar leadership in the arena. It's due to Jeff that we are all here today, who marshaled the partnership of the Harvard School of Public Health and the Bipartisan Policy Center and the National Academy of Medicine to work together, along with his colleague, Emily Zaborovitz. Emily's back over here. And thanks very much to both of you, Jeff and Emily. We commend the Peterson Center for their dedication to the issue, clearly one of the most critical challenges in healthcare. The recently launched initiative that will harness the leadership and resources of 5 prominent foundations is reflective of the importance of this issue. Peterson, along with 4 other partners, all represented here today, including the SCAN Foundation, and Bruce and his colleagues are here. Bruce Chertoff, president of the SCAN Foundation, the Commonwealth Fund, David Blumenthal and colleagues here as well, Susan Mendy from the Robert Wood Johnson Foundation, and I think we have Amy and Marcus from, yes, right over there, from the Hartford Foundation. So thanks to each foundation for the leadership that you're providing in order to ensure that the careful deliberations and insights that we'll have throughout the course of the day will be carried forward into implementation. In your folders, you'll see on the left-hand side the agenda and the participants. On the right-hand side, you'll see the table of contents of the briefing books that you've all received, the project description for our meeting series, the draft outline that's currently in play for the Planning Committee for the report, and then descriptions of the 3 participating partners, the 4, the Peterson Center on Healthcare, the Bipartisan Policy Center, the Harvard School of Public Health, and us at the National Academy of Medicine. So underscoring each and every one of those thanks and anticipating a very expansive and productive discussion, let me welcome and invite Jeff up here to the podium. Jeff.